Put yourself in my shoes, walking in as a doctor or a nurse on my first day on duty at a new facility. I walk up to a computer. I can't get into anything. I can't even access email to figure out how to get into any of my technology I need to do my job for that day.
We come to work to save lives. We need to document. We need to be into the EMR. We need to be in variant applications, and we will access those applications, ideally through our own credentials. But if it's less than ideal, then we piggyback on our colleagues.
What I often end up doing is sharing credentials with one of my colleagues or bosses. And of course, that's no good. It's a security risk and a privacy and compliance issue. And it leads both to inefficiency, but also to poor care and potentially patient safety issues and compliance risk. Password issues can be one of the biggest problems in healthcare. When I get blocked from accessing a system due to password policy, it can be really frustrating, and it's really bad for patient care. Quite frankly, it's dangerous.
When it becomes complicated is if assessing the patient and they're unable to give you their medical history, their medication list, their allergies, all those patient safety components that you rely on the EMR.
And if you interrupt my thought process by blocking me from getting access, trying to reset a password, or fat fingering it and getting locked out and having to call the IT desk, all while I'm just trying to complete a task, that's so bad for patient care.
You know, the patient always comes first and the technology comes second. I'll always take care of my patient, and then often that means that I'm staying behind my shift to gain access and update my documentation, my medication administration, whatever it may be that I have to do to complete my patient care.
If a stroke patient comes in, time is of the essence, and nothing happens until I can access that data. Single sign-on systems that alleviate all the burden and automate workflows on the back end allow me instant access to all those records. It's secure, it's private.
And then I get that capability of badge tapping in. We know it's Claire. We authenticate Claire through that workstation. We authenticate Claire into her EMR. And now we can move forward and authenticate Claire into those applications that she needs to use to complete her role and to enhance her patient care. Boom. Everything is there.
And I'm telling you, it's like magical for doctors and nurses that have this technology in place in the background and set up well.
What I signed up to do is take care of patients. And when the technology is seamless in the back end, it makes the life of an end user, whether it's a medical assistant, whether it's the secretary, whether it's the doctor, whether it's the nurse, seamless.
Really well done technology can actually allow for biometrics, even hands-free authentication with low-energy secure Bluetooth modalities, which is almost instant, and therefore it's more secure, but it is also more productive and efficient and usable for me as a care provider, which allows me to care for you all as patients so much better. So mobile workflows are becoming increasingly prevalent and important in healthcare. Look, we all use these devices in our own life, and it's the same in our work life. We want to use devices where we can just walk up, grab a device that's ready-made for us, that's already provisioned and secure, has a battery, all charged up.
We're authenticating Claire into that device and then giving her that single sign-on access as we do into the desktop. So much more efficient. And of course, a driver for me to use those devices. When everything works, it's boom, my work is easy.
Traditionally, it's been thought almost like a battle between security and privacy and compliance on the one hand, and efficiency and productivity or usability on the other. It's not that way. In reality, good technology can provide greater security and more compliance, and it keeps bad actors out, but it lets people like me and others trying to do our jobs in, and it's actually easier.
Work-life balance is huge, but what we've seen during the COVID epidemic and still coming on the other side of it now is nurses in particular are leaving the profession for many reasons.
Healthcare technology, particularly technology having to do with digital identity, sounds simple, but it's really not. And actually, it's really essential. The better that technology is, the more we can revolutionize healthcare. Really good technology that allows us as doctors and nurses to do our jobs, allows us to see patients faster and in a more secure fashion. And this can be priceless. It can lead to better care, better outcomes, and less burnout for staff and clinicians.